ways in Blackpool through new partnerships, Active Blackpool. Next slide, please. I'd just like to introduce the three presenters this morning. Myself, Sandra Thompson, the Health and Physical Activity Development Officer from Blackpool Council, Laura Ivinson, the Active Community Service Manager at Blackpool Council, and David Redmond, the Research and Insight Assistant from Active Lancashire. Next slide, please. I'd just like to put you into the picture about Blackpool's context in relation to health and deprivation. As most of you are aware, I'm sure, that Blackpool is one of Britain's most popular coastal resorts with a heavy dependence on tourism. We are a small, compact local authority, 7 miles long and 4 miles wide, and we have about 140,000 residents. 25.6 people in Blackpool report that they have long-term health conditions, compared to 20.6% in Lancashire and 17.6% in England. 33.2% of people in Blackpool are classified as inactive, as a comparison again to England, which is 25.2%. Blackpool has been recorded the most deprived local authority in 2019 and 2015. And one of our inner wards, the Bloomfield ward, healthy life expectancy for men is just 47.1 years, and for females, 51.2. Our deprivation ranking is chiefly driven by low income, low employment, poor population health outcomes. 8 out of the 10 most deprived small areas in England are in the centre of Blackpool, and a quarter of Blackpool is in the most deprived 1% areas of England. Next slide, please. So our partners and our stakeholders for this project. This was a brand new approach for the leisure services to work with a new partner, Adult Social Care, to promote physical activity. We had initial consultations with Adult Social Care, meeting with the senior managers who were very keen from the start, which was very, very important to take this project forward. We also have worked with Active Lancashire for a number of years on different projects within Blackpool, and they supported us with our application form for the We're Undefeatable programme, and they've also assisted the project with insight and with the evaluation. Active Blackpool have worked with a number of Richmond charities locally, for example, Diabetes UK, MS Society and Macmillan. But this project has given us the opportunity to start new conversations with new with new charities such as British Red Cross, Versus Arthritis, just to name a few. Can I have the next slide, please? Thank you very much. Our target audience for this pilot was those who were referred onto the re-enablement programme, which is delivered by Adult Social Care. And just to give you a little bit of an insight on what the re-enablement programme is, it's an intermediate offer to support people in their own homes with long-term health conditions. And it's a short-term intervention with the purpose of maximising independence and self-care. So our project aims for the re-enablement programme was to provide education, improve awareness of physical activity opportunities within the community, and help people with long-term health conditions be more physically active. Next slide, please. So we did our pilot with a three-strand approach even. The first strand was for the Active Blackpool team to go out with the re-enablement team and meet the service users. We were also supposed to deliver a physical activity session within the community at the Arc itself. Our second strand was the training element, and this was to educate non-clinical employees about physical activity and long-term health conditions. And our third strand was to create awareness of the Active Blackpool programme within Blackpool and to make an awareness of the We're Undefeatable campaign itself. Next one, please. So Strand 1, the first strand of this project was to link a qualified fitness instructor with an occupational therapist. And they were supposed to go out and visit people in their own homes, assess their needs and their current level of physical activity before sitting down and having discussions about possible ways of being more physically active at home, what was about in the community and what Active Blackpool had to offer. Within this strand, we were all supposed to deliver some physical activity sessions in the community at the ARC itself. Now, what we learnt. The visits that we did were very, very positive. The fitness instructors thought it was a new way to get information to people with long-term health conditions about the benefits of being physically active and what was available to them. The occupational therapist commented that because the fitness instructor worked in this field, they seemed to be able to pass over the information about physical activity with more passion. But both the occupational therapist and the fitness instructors both said that they thought it was a good way to get information to clients in a very relaxed environment because it was in their own homes. Now, we did have some challenges with Strand 1. The first was some staffing issues within adult social care due to sickness and people changing jobs. So we weren't able to do as many visits at the start that we would like to. And then obviously the COVID pandemic hit the country, which put extreme pressure at those times on adult social care. So we were unable, due to the restrictions, be able to go out to visit any more homes and to do the activity sessions at those times. Our success. We now, because of this good partnership working, have a real good understanding of what the re-enablement service is. They have a good understanding of what there is on offer within Active Blackpool and the referral pathways between themselves and the exercise and prescription, as well as other activities that are going out in the Active Blackpool programme. Because of our partnerships at this stage that we had with adult social care, during the pandemic, we were able to go out, visit people on their doorsteps, deliver food hubs and food parcels, and deliver information about being more physically active in the home, where they could go for a walk, and what was available after the restrictions had been lifted. Next slide, please. I'm just going to finish off the Strand 1 with a quote from one of the fitness instructors of what they thought of the visits, and I will actually just read it out for you. I joined an occupational health therapist for the day, visiting clients in need of adaptations to their homes and to check on others who'd already had work carried out to make sure it was proving useful to them. These adaptations allowed people to continue living in their homes and give them the independence they want. We spoke about the We're Undefeatable campaign and left leaflets so that they could exercise at home and made them aware of the Active Blackpool offer. Some clients were interested in the leaflets and felt they could do some of the exercises at home as they were quite straightforward and easy to follow. We spoke about the benefits of exercise and how it would make everyday living easier if they were feeling stronger and more confident and moving around their homes. So as you can see, the fitness instructor thought it was positive to go out with the re-enablement team and give that really important information to those people with long-term health conditions about being more physically active. I'm now going to pass you over to David Redmond, who is going to look at Strand 2, which was the education part of our project. Thank you.
Morning, everyone. So Sandra said, I'm David from Active Lancashire. Bit background around me, I work in the Research and Insight team. So a lot of my work is focused on working alongside delivery partners and people on the ground and trying to understand and make sense of the impact programmes such as this one here we're talking about today has had in that community. So what I want to focus on today is more around what we did for this programme, so around understanding delivery, the impact of the training and long-term impacts that may have occurred. So I'm just going to give you an outline of this at first. So what we learned, we discovered that there was a new way of training and learning to meet the needs of the care sector. Traditionally, training may have taken place out and about at designated centres, actually by working more closely with people, listening to their needs and understanding what it is they need through collaboration, we could better deliver training. Some of the challenges we found with that is the COVID pandemic prevented face-to-face training, and we at Blackpool delivered online virtual training offers, which brings its own challenges because there is that lack of interactivity. People tend to feel less confident. Like today, many of you probably haven't got your cameras on. It's that interaction that we thrive on, and that enables a much deeper and richer understanding of the topics that we're talking about. It also impacted our evaluation. We had planned to do a survey post that they complete the training. After that training, they complete a survey, and following that, they would then go on to take part in focus groups. We quickly realised the focus groups weren't going to work, again because of the interactivity challenges. So we decided to do a follow-up survey at least 2 weeks post-training to try and capture some of that information that we wanted to capture within the focus groups. I do apologise about the firing if you can hear that. It's gone now. Our successes. 67 participants attend online training, of which the majority completed our feedback survey, which is really, really useful because it provides some insight, which we'll talk about in a minute, about its successes of the training, the challenges with the training, and actually pushing that training into practice so they're confident, their competence and ability to convey some of the messages with their clients. Next slide, please, Laura. Thank you. So when you're looking at training, one of the most obvious areas you want to look at is course satisfaction. The reason for this is with the new course, it's important to understand and to identify whether or not the people coming on board are finding it to be suitable for them. In other words, is the content matching the expectation and needs? We found that the majority of participants felt the course met their needs despite the challenge of virtual delivery. And I just wanted to pick out a couple of things. So when you look at figure 3 on your left, this covers course satisfaction, usefulness, organisation and relevance. As you can see, the majority of people there agree and strongly agree. However, there is certainly an area of 15% around neutral of usefulness in the workplace. Now this highlights two things. One, it's a new course, people's expectations and meeting expectations may not match. Two, the way it was delivered may have meant that actually the lack of practical elements reduced the opportunity to be able to see how it works in practice. And that's where the follow-up survey comes in, because it's clear to see that is when they can put it into practice for the first time. Next slide, please, Laura. The confidence levels. This is very important because you can go through training and you can have all the knowledge and all the skills, but if you don't feel confident delivering in the community, it's not going to come across the way you necessarily had hoped. So we did 2 confidence checks, one post-training and one at least 2 weeks after. Overall, confidence is growing. People have some confidence. If we had done it face-to-face, we might have expected higher confidence after. But again, with all the virtual delivery being new to everybody being involved, both from the course tutor perspective and of the receiving end of the care sector, there is going to be some elements that could be improved further on, which I'll highlight later on. A couple of areas I want to pick out here. So we look at course level, confidence level immediately post-training. We can see that the majority of people are somewhat confident. With growing onwards to confidence level post-training, we can see that, for example, supporting clients to be more active has improved, and we can see that referrals to clients has had a bit of a dip there into not confident at all. Now, it's one thing to highlight is that there's a slightly smaller sample, so therefore the differences can be exaggerated. What does highlight here is the potential for need for more long-term support, where somebody may feel that there's an element of the training that may not have been as confident at, and by having that long-term support in place, they could have that top-up, refreshers if you like. The next slide, please. One of the other questions we asked was whether their understanding and knowledge around physical activity can be used to improve health, because that is the core essence of the training at the end of the day. And the overwhelming majority, 80%, rated their knowledge as good or very good. And this clearly demonstrates that the backdrop of the We Are Undefeatable initiative was effective at teaching participants, in this case the care providers, about the importance of sport and physical activity. Next slide please, Laura. So now we want to look at the real world impact. We've looked at the training, we've looked at their competence levels, and we've looked at their knowledge. What impact it's had in the community. We look at the Sporting Active Life survey. It shows that Blackpool is one of the highest levels of inactivity. So this is a clear area that this could have an impact. Therefore, any project that aims to tackle this should be aiming to move more people from doing nothing to something. Moving people from something to a lot is going to have less impact in an area where there is very, very little activity already taking place. You're moving a smaller group. Your bigger group is with those who are doing nothing to something. So this was our key interest. What we have found, it is clear that this initiative has provided a platform through training to those who work within the care sector to begin the behaviour and culture change required to move people from nothing to something within the Blackpool community. We found that those who have undertaken the training has experienced some of these stories, and this is a snapshot of some of them. And some have said that they've encouraged more moving advice and understood the reasoning for it. They've used the extra knowledge to help others to be more active. So we can start to see that through this training, they've got this knowledge and understanding. There's something that they didn't have before. They could take it to people who had had very little experience perhaps, or currently doing very little physical activity. And they were then able to be equipped with those tools and examples of what exercise and activities they could do even within their own homes. To you and I, who may have been already physically active, may seem quite straightforward. To them, it's quite a big leap. So the little steps that help, that make the bigger impact that we're going to see over the longer term. Next slide please, Laura. So some of the challenges, I think this is an area that is sometimes overlooked with a lot of project evaluation. We often tend to focus on what's gone well, but not necessarily focused on, well, what have been some of the challenges? Where can we support better in the future? The most common challenge faced is service users being unwilling or show a lack of confidence to try new activities or experience. And this is quite interesting because it links back to what I was saying before about the level of inactivity. If they're unwilling or show a lack of confidence, it's probably more key. The training the care providers received, as their confidence grows in that, the more they start to talk about it, and the more they get to know about the barriers some of their own clients face, the more they can tailor that support, and the more they can tackle some of the confidence issues they're facing. And this links to the next point, because behaviour changing action takes a long time to take place. And I think some people go in with an expectation that it's going to happen overnight, or it's going to happen over a month, it's going to happen over 2 months, 3 months, 6 months. This change is going to take 12 months, it's going to take 2 years, it's going to take 5 years. As we tackle those with less and less confidence. And one of the things I like to look at is when you try to break an old habit or take a new habit on, you have to do it for many weeks, keep reminding yourself to do it. As once it becomes ingrained and becomes second nature, then your confidence grows with it. We also found that some people shared with us that they felt they needed further training, that the course could be further expanded, that some of the clients they were meeting with had specific medical conditions that may prevent them from undertaking certain strenuous activity. And that by having that awareness and being able to understand, as given medical conditions, say high blood pressure, or they have a sensitive heart, what activities are suitable and complements that? Having that link, having that understanding further builds that confidence. And some other areas they faced, challenge-wise, was around COVID and the fear of joining in. So if they're group exercises, perhaps they weren't comfortable working in groups of people. Mentioned before, there's the information around service users' medical conditions and awareness of that. And some service users are unwilling to accept advice. Now, that is to be expected, and that comes with challenges of behaviour change. It takes time, but I strongly believe that this is starting the foundations for a long-term change, providing we keep at it. Next slide, please, Laura. So, a bit of a summary. The project has adapted well to work with the challenges of COVID-19, and we can see that through some of the feedback from the confidence, competence of the training and the usefulness. Overall, the project, I believe, had been a success based on its ability to educate care staff about the following: the benefits of physical activity, how people with long-term health conditions can become more active, and the availability of physical activity opportunity within the local community. So it's linking council, active Blackpool, leisure providers, the care sector, all of that together, sometimes work in silo. Having those communications, having that shared understanding could be passed on to the clients. They are aware that within the local area, there are certain activities that are taking place. And the element of social prescribing can take place once they feel more confident about engaging with physical activity. And as we've mentioned before, there's always room for further improvements. No matter what project it is, it's probably never going to be 100% perfect. There are ways that any project can improve, and we've identified some, such as refresher training, one-to-one support, or small drop-in sessions. Opportunities where those who receive the training can go in, can ask questions, and receive that ongoing support, and they feel like they're being supported in their work. And finally, this is the beginning of changing the way care sector approaches physical activity. This is only the start. We planted the foundations. What would be really interesting to see is if we revisited it in 2 years' time, 5 years' time. What's been the change? Has there been any changes on the active life survey? Have Blackpool begin to move from being inactive to somewhat active, and potentially even fairly active? That's a very aspirational target, and as I mentioned before, it's more important moving from nothing to something, and then we can start to work on something a bit more. And finally, I would just like to leave you with this one. The majority of people would recommend the training. Now, I would have liked to have seen this a bit higher, and again, this comes back to being virtual delivery. It could be interesting if you revisited this, did the training face to face. Would this percentage be a bit higher? Possibly. And again, it comes down to that interaction, that networking, and that connectivity. Next slide, please, Laura. What I'd like to do now is just leave you with a couple of videos about the delivery, and we get to see the experiences.
Hello, I'm April.
And I'm Lyndon, and we are Active Lives Coordinator on the Get Out Get Active programme.
The training for healthcare, physical activity training for healthcare professionals were really beneficial for us as we go out into the community, engaging people in all sorts of different activities, and to be able to talk to them about long-term health conditions and how to build activity into their routines was something that's really fits in for our programme. So we've been encouraging them to come to the community centres, to be able to join in some activities, some health walks, some cycling, and we've linked with lots of different partners across Blackpool in order to share the learning from the training programme.
We have worked with people with long-term health conditions such as strokes, and we've done lots of wheelchair exercises with them. We've done a lot of online stuff with chair-based exercises, and the stuff we've learned on the training has really been beneficial for the people that we work with.
The statistics from Blackpool obviously are really shocking, and our job role is to be able to work with the most deprived areas of Blackpool, so to be able to make sure that we are being a positive influence on residents in Blackpool is something that fits with our programme really well, and we're really enjoying making sure that people living with long-term health conditions have the best possible outcome in Blackpool as possible.
Hi, my name is Jill Harding and I work for the Active Blackpool Exercise Referral Scheme as an instructor. Now, we were asked to develop a presentation which we could show to care providers on the importance of physical activity for people with long-term health conditions, and how we can give them advice on how they can help people that they come into contact with to become more active. Now, we were hoping to deliver this face to face, but unfortunately the pandemic came along and we had to rethink how we were going to get this message across. And we decided that we were going to put together a presentation which we can deliver on Teams, which is interactive, to try and get the message out there. Now, this worked really well, even though COVID came along. That put a lot of pressure on care providers. They were short-staffed, they had a greater workload. So how we got around that was we put lots of sessions on over several months in the hope that we could catch as many care providers as possible. We discussed how to encourage people to participate in their own care by giving them small tasks to do while carers undertook the more major tasks, in the hope that gradually they could become more active and do more things for themselves. We offered advice, support on how to overcome barriers to exercise. There was quite a strong feeling out there by service providers that they didn't want to participate in their own care. So we had to kind of find a way to change that mindset. We gave advice on what was available in the community. There are community centres who provide all kinds of activities. The Active Blackpool Exercise Referral Scheme, where I work, they provide tailored exercise and activity schemes for people with particular long-term health conditions, such as cardiac or neurology, as well as just general GP referral classes. What we hope to do in the long term is to change the mindset of both the care providers and the service users. The reason for that is that by being more active, you're going to have a better mental and physical health, you're going to live longer, and you're going to have a healthier, happier life. But that will also have an impact on the carers themselves, because if they have less work to do, because the service provider's helping out, that's going to reduce their workload. And then there's the consideration of the overall cost of care in the UK, which will also be reduced. So we hope that this can become the way forward for care services in the future. Thank you.
I'll thank Jill virtually. Hi everybody, and thank you David for going over the evaluation for Strand 2. I'm just briefly going to go over the Strand 3, which is the awareness of the Active Blackpool programme within Blackpool. And I think I want to start with the challenges, because as Sandra has already mentioned this morning, the COVID pandemic, when it hit us, we had literally just secured the funding to start this pilot, and it altered everything. And I think everybody's mindset within the team had to change. Our job roles changed. You know, Jill that we've just heard from there, she was delivering food parcels. She was carrying out welfare checks on people that were isolating. And again, going back to the pandemic, we were being told we needed to stay in, we needed to protect ourselves. We could get out and do an hour's activity. So I think, yes, that was a huge challenge for us. And that's why I wanted to start with it, because again, as we've already said, the capacity within the GPs, the capacity on adult social care, everything increased. I've also listed there that, you know, leaflets, people weren't accepting leaflets because they weren't sure what, you know, if COVID was on these leaflets. You know, it was the unknown. So there was a lot of challenges with Strand 3. But I think at the same time, for us in Blackpool, as I'm sure across the rest of the country, it did present an opportunity, because, you know, Jill, who started going out and doing phone calls, welfare checks, getting out into the community, I think it started to change the mindset and the culture, which again, you know, that's one of the words David has been mentioning, of the team, that were actually going out, and normally we'll be delivering an exercise class, a GP referral class in a leisure centre. And again, for our service, it was a change in our culture. We were going out and knocking on people's doors, having those conversations. We were delivering, as I've said, food parcels. We ended up delivering exercise equipment as well, so that people could actually be active within the homes. So I think, yes, there was a lot of challenges with COVID, but at the same time, we kind of wanted to explore the opportunities. So as we've put on here, we wanted to obviously raise the awareness of the Active Blackpool offer. And again, that might have been a health walk. It might have been an exercise referral class. We wanted to really explore and, you know, create more opportunities for people to be more active. And again, like what David has said, those who are inactive, we just want them to be a little bit more active. So again, with regards to this, the Corona Kindness, that was the campaign that Blackpool Council adopted. And as I say, the whole of my service were pretty much working on that programme, carrying out the welfare visits. We also, when we received the leaflets, the We Are Undefeatable leaflets, we wanted to get them out as far and as wide as possible. So again, they were getting a food parcel, but we also put in there a We Are Undefeatable leaflet that had some of the exercises in there that they were obviously able to take part in. We started online Zoom classes as well, which again was you know, great for promoting, you know, physical activity, health and well-being. Also, one of the successes around this, obviously people then started getting the vaccination. So again, in the Winter Gardens, we took a load of the We Are Undefeatable leaflets down there. So again, we were just trying to raise the awareness of the campaign. And yes, people do have long-term health conditions, but again, at the same time, they can still move a little bit more to help with their condition. So again, on there, we've got that we've kind of delivered over 4,000 leaflets. And this also, us going out into the community, really did help develop those partnerships. Sparks, that's a community group. Now, the reason it's called Sparks is because it's where people come up with ideas. Okay, so and on there, there's probably 60, 70 different organisations. And again, it's great that we are involved with that group and that we can share this information, and people know that we are here as Active Blackpool if anybody does want any support when it comes to, you know, physical activity, health and well-being. The one thing that I'd wanted to also mention, so again, obviously the exercise referral programme and everything that Sandra and the team have been delivering for many years in Blackpool, obviously with the pandemic, everything had to stop. And again, GPs stopped referring in. Now, one of the things that we've obviously been looking at recently is obviously our recovery rate. And pre-COVID, we were receiving in excess of 100 referrals a month. Okay, so another measure that we've actually looked at recently is we're now back to about 70%, so about 70 referrals per month. And again, I believe that all the work that has been carried out throughout the pandemic, the conversations that we've had with the local GPs, the local community groups about Active Blackpool and the referral programme, and we, you know, with that now we also do talk about all the time we are undefeatable. And yes, we do have a lot of people with a long-term health condition, and I think we sometimes think we see that health condition before we actually see that person. And yes, just because somebody has that long-term health condition, the first thing we think is, what can't they do? And again, I think changing that culture within adult social care through the training, we need to be looking at that individual and thinking, right, okay, what can they do? Okay, so again, when we're going into people's homes, you know, if they can still go up and down the stairs, let them continue to go up and down the stairs. If they can make their cups of tea and coffee, let them continue to do that. Yes, we might be going in and thinking that we're helping them by making them their cups of tea, but we're not, you know, and I think that's kind of some of the work that we want to continue to do moving forward. So that's just a little bit around the Strand 3. And as I say, I really do believe that all the community work that the team have done throughout the pandemic and the use of the We Are Undefeatable campaign really has helped with the recovery post-COVID. So I'm just going to move on to next steps and future plans. Again, I wanted to, when we first secured this funding for the pilot, we had an out-of-date physical activity strategy. Now, we have since changed that, and we've been given an opportunity to develop our active life strategy, because again, I think a barrier for us was that people weren't always interested in sport and physical activity. They maybe thought that they needed to be a member of a gym, they needed to be you know, part of a sports team. So as I say, earlier this year in January 2021, despite the pandemic, we were still able to launch our active life strategy. And again, with that strategy, we didn't just, it's not just for us as a service, that's not just for leisure services. We met and consulted with public health, we met and consulted with adult social care, children's services, all our third sector organisations, in order for us as Active Blackpool to be the strategic lead in physical activity in Blackpool. And we really, in the first 12 months, we have, you know, we've got 4 priorities, and one of those priorities is people with long-term health conditions. And again, I firmly believe that this has been a priority off the back of the We Are Undefeatable pilot that we've been delivering over the last, you know, over the last 12 months. So moving forward, the partnership with adult social care, that is continuing to develop. And again, I'll touch on it shortly, but it's just going from strength to strength. And again, without this pilot, I don't think that we'd be in the situation where we are at the moment. Again, like we have said, we don't want the We Are Undefeatable campaign to go anywhere. We want to continue to promote that. We want to continue to use that and share that with people in Blackpool around the long-term health conditions. And again, you know, talking about the partnerships, we want to continue to work with all of our local partners, whether that be people that are sitting on the Sparks group, or whether that be the, you know, national partners, including the likes of Sport England and the Richmond group of charities. Sandra mentioned earlier on that we're working with a lot of them, but again, we want to be working with all of them so that we're able to, you know, really focus on that partnership development. The training toolkit, sorry. Again, as we have said, you know, it's been great. It's been really good, and I think moving forward, it would be nice to offer some more support for those people that are working within adult social care. And I think there's also that opportunity to share that information within that toolkit with other services. So again, that's something else that we will be looking at. I've already said there about that we're going to continue with to promote the campaign locally. The next one that I will just touch on, because our work with adult social care has gone from strength to strength, and we are next week actually launching the Live Longer Better pilot in Blackpool. And again, we've had conversations with Sport England around that. Again, that is another pilot, but I just think these pilots are so valuable in what we can actually learn from them. And again, adult social care and the CCG, we've got a lot of partners involved with that. And then we're also able to launch new programs such as the Fresh Air program and look at elements such as digital inclusion. And again, I think some of those will be popular because of the pandemic. If activities are taking place outdoors, we might get more people engaged. And again, because we're now all online and we're obviously delivering talks and conferences and things online so much, there's a lot of people that we feel are being excluded from that. So again, we're looking at seeing how we can actually support them to be more digital and get them online. Last one on there, as I've already said about the Richmond group of charities, we are really keen to work with the ones that we've not reached out to over the last 12 months, and I think that will help with future programmes moving forward. I'm just going to move on to the next slide, and there's just a little bit of feedback from Nick Henson, he is head of service for the care and support at Blackpool Council. And one thing as well, just to mention at this stage, is we have created, and we've now got a strategic group around people with long-term health conditions. So we're actually next week again meeting with the head of adult social care to really look at how we can develop the strategy moving forward, and try and look at that culture change within some of the care homes. So I will just play Nick's video.
Council has been working with Active Blackpool in supporting individuals to raise awareness around physical activity in the home for people that are in receipt of either health or social care services. As a council, we already deliver a reablement service which sets out to improve activity around the family home as part of their journey towards greater independence and reducing the likelihood of ongoing care. The support we've received from Active Blackpool has enabled our carers and the people that are in receipt of care to understand what the opportunities are around the home to increase their activity, so that they don't necessarily have to leave the family home to do that activity. This has been particularly important during COVID, in that when we were in lockdowns, people were not able to leave the home. And actually having those opportunities and understanding what those opportunities are in the family home have been really important. And our workforce has really benefited from understanding what those opportunities are and the support from Active Blackpool. The impact upon our service users, given that COVID has been such a huge, a significant pandemic for Blackpool and the rest of the country, is that they have found that having that activity around the home has maintained their well-being when they've not been able to go out and see family members or even to go out and do some shopping. So their activity level has reduced over time, but actually having some activity around the home to do has enabled them to maintain those levels for going forward. As we know, the pandemic we're working through our pandemic, and COVID is going to be with us for a long time into the future. So it's really important that social care and health services work with our professionals in our leisure services to maintain people's well-being through activity at home, especially as we enter a different phase of COVID in the future and potential more lockdowns. We need to ensure that people's activity is maintained.
Okay, so just moving on to the last slide before we take any questions. What would you recommend to others considering a similar approach? So what we've just seen there is Nick Henson, who I met with before we'd even put the funding application in for the pilot. And I just think that the communication and the conversations that we've had with him and his team, and the learning that we've actually got from this pilot, that film was recorded a few weeks ago. And as I say, I've had other meetings with Nick. We're meeting with his boss next week. And it's for us, it's been invaluable. We have also had conversations with colleagues in other areas of England as well, around how they've tried to do it and where they've actually seen systems change. And so we've actually approached, and we're continuing to have those conversations so that we can actually see a whole system change within adult social care. And again, it's like we've said earlier on, this is the start of our journey here in Blackpool. With our partnerships, it's the start of changing the culture as well, whether that be our staff and staff within adult social care. I think for others, it does need to be kind of a top-down approach. We're meeting with the head of service next week. If they're on board, then we can actually start to see some real change. listening to what others have done. Like I've said, you know, we had a really invaluable conversation with Calderdale, which was great. And again, because we've seen that they can actually, and they've made changes within their services, we've actually shared that with our teams, and that they can actually see that if we're all working together, then we can implement this change. And again, getting everybody around the table to implement the change, rather than just the head of services, you know, and us all sat there saying, right, this is what we need to do. We need everybody's input. So that's kind of where we're up to. And, you know, like we've said, this is just the start of the journey here in Blackpool. So thank you very much for listening. If anyone does have any questions, or if anyone would like to get in touch with myself, Sandra or David around the work that we've been doing, then that would be great. Thank you.
Thank you so much, Laura, and thanks also to Sandra and David for presenting today. That was a really inspiring presentation, actually, and I think a lot of people will be interested in the partnership that you've developed with Adult Social Care. I think one or two are keen to get in touch with you directly, so also thanks for sharing your contact details here. Unfortunately, we don't have any time left for questions, but as you've given your contact details, people can get in touch with you directly if there is anything to follow up on. Also, thanks to all for joining. If there are any questions you'd like to share with me, I can also filter them, or if you've got any problems with accessing the other sessions or recordings, I'm at barbara@insightangels.com. But thanks again so much to our presenters and to everyone for joining today, but we'll close there now. Thank you.